I just sent you a chat. Catherine, can you hear me? I can see you, but I can't hear you. Abby, do you have any suggestions on what I might be able to tell Catherine?
I think you've told her what there is of logging off and logging back on again.
Yeah. Abby, do you have any suggestions on what I might be able to tell Catherine? Oh, why did that come back?
I think you've told her Hang on. What there is of logging off and logging back on again.
Yeah. Abby, do you have any suggestions on what I might be able to tell
Oh my goodness. Hang on a second.
Oh, I can hear you, Catherine.
Oh, you can?
Yeah.
Oh, okay.
Just barely, so you might have to speak up.
Okay, so I have something that says speaker view.
That's if you just want to see who's ever talking. If you want gallery view, you see everybody at once.
I usually see everybody. I see you two.
Okay, just go up there and click click speaker view, and then it'll say gallery view, and you'll see everybody.
Okay. All right, y'all still hear me?
Yes, uh-huh.
Okay. All right, I see Diantha. I don't hear Diantha.
Sorry. Hello.
Hello. Look, I am not good with Zoom, so don't know.
I think you're doing great. I can see you and hear you. What we ask?
I would suggest that you change your name So you rename your box to your name instead of whatever your login is, so we can see actual names.
So Catherine, she means you. What you have is it looks like 944 something, Kath. I think
Catherine, yeah,
Yeah, so in the in your box in the top right, where you see the 3 ellipses, you can click that and it'll say rename. And if not,
okay. So rename my
what you'd like to be called today?
oh, well, I just
Princess
like,
Catherine? I don't know.
yeah, I'll just,
I like that.
so what do I do? Delete it and write Catherine back?
Yes.
And Phil, before we go too much further, I just want to let you know, I have another one of those MPO meetings at 4 o'clock, so I'm going to jump off, just so you know.
Okay, it's nice to see you.
Join you for what time I have. Yeah, that's the nice thing about Zoom. I didn't have to get in the car and drive.
That's the good part about it.
Hey, Karen.
I've been working all day, doing stuff around here. Yeah.
Yeah.
Okay, Karen, I see Karen.
Hi, Karen.
I can't
You're
hear
on
Karen.
mute. You're on mute.
Got it.
Your quilt behind you is beautiful.
Thank you.
Very nice backdrop.
Yeah.
Yeah. For those of you who don't know, and maybe most of you do, Karen's quite a quilter.
Oh, yes, I did know that. Well, that's Liz.
All right.
Hi, Mary.
Hi, Mary. Liz was coming on, but she didn't come on yet.
I came on, I just came on without my video because I'm having a little trouble with that. It's a little
Okay.
unstable.
Good,
I'm
good,
here with my voice.
good.
It's nice to see you.
Nice to hear you. Good.
So Jenny had something come up at the last minute that was unavoidable. So we probably won't see her, and Mary as vice chair has agreed to chair the meeting. So let's wait a couple more minutes and then we can get started. I think we're still expecting Amy. Lisa, did you hear from Ray? Lisa?
I didn't hear from anybody
Okay,
other than Jenny.
okay.
Can I ask Catherine how her husband's doing while we're waiting?
Sure.
Much, much better, much better. He's been outside on the tractor and did a little bush hogging this morning.
Wonderful. And he's
Much
taking
better.
care of his beagles again.
He's still feeding and watering the beagles.
Wonderful.
Good, good. Thanks for asking.
Would he like another beagle? Just
Oh, where is he? Jim, would
Just
you like
easy.
another beagle, Liz Farmington? He's not sure. I'll give you a call.
I was actually just teasing. There are times when, my beagle has gotten so old, he's ignoring rabbits, and the rabbits have eaten all the chrysanthemums in my backyard now.
Oh, wow. Well, these two don't do anything but eat. Eat and sleep.
That's about all he does these days.
Phyllis, do you want to go ahead and get started? Or
Yeah.
do you wanna wait a little?
Let me just check with Lisa about whether we have a quorum. Lisa, do we have a quorum without Amy or not until Amy comes on?
We need 4.
So I've got 1, 2, 3. So I've only got 3. So
I'm gonna
we don't
text
have a
them.
quorum until and unless Amy arrives. So we can't really approve the minutes, but we can go ahead and do the informational items. And then maybe if Amy jumps on, then we can go back to the minutes.
Okay.
That makes sense?
Yeah, that does. I'm gonna text her really quickly and see if she just forgot or got sidetracked.
Okay.
Okay, well then I'll call the meeting to order. We will wait to vote and approve the minutes until we have at least a quorum. And I want to remind everybody, just point of privilege on my part, just to try and keep yourself muted unless you're planning to speak anytime soon, because in meetings with, I find more than 2 or 3 people, inevitably we hear dogs barking and my children will come up and talk to me. So if just try to keep yourself muted as much as possible, it makes the whole meeting go a lot nicer. So because we are not going to be approving the minutes, it looks like we're going to move on to our information items. And we have information items from 2 months because we didn't meet last month. So I hope everyone had a chance to review July and August informational items. Phyllis, you want to give us the scoop on all of that? And then do you want to do questions at the end?
Sure.
Okay.
So one thing I'll mention is that I asked Carol Fox, who is our Bright Stars program coordinator, to come to the beginning of this meeting because the informational items had a lot from Bright Stars. And instead of trying to answer questions myself from a less than informed perspective, I want the expert here. So if you have any questions about the Bright Stars items, I'll just defer to her. So I wanted to highlight a couple of things from the administration items from August. And one of them has to do with the new legislation that mandates VDSS to develop a corrective action process if a local department is not fulfilling its mandates or doing what it's supposed to do. And one of the reasons that I shared this with you is not only to share that I'm on the work group that's developing that, but that as an advisory board, you would be involved in that kind of process if Albemarle was unfortunately in the middle of that. So I wanted you to have information about that from the get-go. And I thought it'd be helpful to highlight the specific legislation that was passed. The other item has to do with our agency self-assessment. Both Wanda and Alice, who are here as our main presenters, worked on the team that conducted the self-assessment. And so we are now looking at the recommendations made by that team to develop our continuous quality improvement plan. And so I highlighted some of the categories that the self-assessment team looked at our agency and measured our agency in relation to those categories. And again, those come directly from the Malcolm Baldrige framework, which is at the federal level. At the state level, it's the SPQA framework, which, as you know, we've been awarded two different years. We were awarded the SPQA award when Kathy was still here. And the self-assessment is kind of the first step towards maybe pursuing another application for an SPQA award. And then in July, I didn't have any administrative items. because I just put them all in August. So those are my highlights. I'll be glad to entertain questions. And again, if you have questions about the Bright Stars items, I'm just going to turn it over to Carol. Any questions?
I had made a note. It mentioned, well, first, I love to see the part about Brene Brown. She's one of my favorite people. She has a podcast that I listen to called Unlocking Us, which is really great. And I've read a few of her books too. So I was really excited to see that you guys were listening to her and talking about her and using her research on shame and vulnerability in your work. So the July information items mentioned a pamphlet that talks about the safe way to bring someone home from a nursing home, but I didn't see that as an attachment. Were we supposed to receive a copy of that pamphlet?
That's a good question. Lisa, did Tricia send you anything?
She might have. I'll have to check. If so, I will forward it. If not, I will ask Tricia for it.
Okay, because it did say they were hoping that the board could help distribute that in the community and make sure that they're aware of those resources and that information. So I would like to see it and like to have a copy if possible.
Okay.
Absolutely.
Thanks.
We'll get
That's
one
all
to
I
you.
have. Did anybody else have anything?
Mary, I think this is the first time you've not had a question about Bright Stars. I was so prepared. You have to ask something.
Give me a minute. I might think of one. No, I love to read the updates on Bright Stars, and the part about the graduation ceremony, the drive-by, was so cool. I love seeing the pictures. Yeah, it actually made me sad because I miss my students and I miss school and I miss regular life. So seeing the kids is good, but it's also hard at the same time. Okay, well, I guess if there are no more questions about information items of July or August, then we'll move into the presentation. Is that okay?
Sure. And Carol, you're welcome to stay or sign off, whatever you prefer.
I'm going to jump, but thank you for inviting me. I'm going to go back to working on getting some kids enrolled.
Good deal.
Thank you.
All right. So I'd like to introduce, although I think you've probably already met them, Alice Mcluhan and Wanda Horman, who are our two assistant directors. Alice has oversight of our child welfare program, the self-sufficiency team, and our school-based programs, both Family Support and Bright Stars. And Wanda has oversight over all of the eligibility programs, including the Office of UVA Medicaid and our housing office. And so I asked them to share some information about some of the work that we have started to do and will be continuing on looking at equity issues in our work here in DSS. I actually invited Siri, who's the director of the Office of Equity and Inclusion, to attend, and she was going to try. So hopefully she'll pop in because I wanted her to be able to be to know what we're working on, and if she can also offer some input. So with that, oh, there's Siri. Great timing, Siri. We were just about ready to start the presentation, and I was sharing with the board that I had invited you to come and listen.
Oh, well, I must have heard you calling me, Phyllis. You know, I come when called.
Yeah.
New Wednesday.
Thank you for being here. All right, Wanda and Alice, I will turn it over to you, but let me get your PowerPoint up first. Hold on just 1 minute.
Well, while she's working on that, I'll go ahead and sort of lay the format for what we're looking at. We have been looking at how our services are delivered and if there is any problems within equity for the services end of things and eligibility end. we've come across, we're looking at it from many different directions, because you can't just, pigeonhole one area as being the problem. So we're trying to do a very good drill down look to see what all opportunities we may have to correct anything that's within our power to correct. Phyllis, are you able to?
Hold on just 1 minute. I saved it to my desktop and I'm not seeing it, so I'm going to go back to your email. Just give me 1 second.
Go to the last email, the one today.
Yep. Okay. Okay, got it up. Now I just gotta get back to the meeting. Okay, can you see that?
Now we can.
Yes.
Do you want to make it, there you go, slideshow? Yeah.
Yep. There we go.
So the question is, are we a racist society, a system that needs to be reimagined? Let's see. I'm sorry, I had the chat pop up, so I was curious if that was for me or not. It's not. So Albemarle County population, as you know, what we did, we've gotten population counts from different areas. There's 109,330 people. That's according to the 2019 census table. Of that, 77% are identified as white and 23% are identified as non-white. What we looked at in the eligibility world, I'm going to present first about eligibility. So for SNAP, that's our Supplemental Nutrition Assistance Program, sometimes known as food stamps. There are 4,746 individuals. That's not numbers of cases, that's numbers of individuals. So one case may have one person on it, and another case will have 10 people on it. So there's 4,746 individuals that are receiving SNAP in Albemarle County. 63% of those, or 2,992, identify as white. And then 37%, or 1,754, identified as non-white. So that's, a good, in alignment with what our population is. Next would be the Medicaid benefits, and in Medicaid, 12,901 people are receiving Medicaid benefits. That would include long-term care assistance in our nursing homes. That includes help with paying your Medicare bill, as well as the full Medicaid benefit. 65%, or 8,435, are identified as white, and 35% are identified as non-white. And then we get to TANF, and that's temporary assistance for needy families. That's a cash money payment. We have 241 people that are receiving TANF benefits in Albemarle County. Once again, that's not cases, that's total people. 63% identify as white, and 37% identified as non-white. So in Albemarle County, the population, again, is 77% white, 23% is non-white. So for SNAP, it's 63% white and 37% non-white, kind of in alignment, about a 10% difference. Same thing for Medicaid, and the same thing for TANF. In the eligibility world, you can't make very many independent decisions. Our decisions are very governed and very regimented about who's eligible and who's not. So the race factor is not able to be played within our determinations. It's clearly a math issue. And so approvals and denials occur based on the prescribed formulas that we have in the system. There's not a lot of judgmental opportunities within eligibility. I'm going to turn it over to Alice, who's going to talk about the services side of the house.
This is a lot of our child welfare staff. This was taken at one of our monthly child welfare meetings about a year ago. Doesn't quite have everybody, but I included it because at a glance, when you look at it, you can kind of get a sense that there is not there's limited amounts of diversity on our child welfare team at this point. There, you can see we have some, but there's a pretty significant number of Caucasian women comprising our staff. So to be more specific about that, Phyllis, next slide. We have 57 total positions with 7 current vacancies. So 28% who do not identify as white. And this is the breakdown of the particulars. If you want to just show all those, Phyllis. So in our self-sufficiency team, that team in particular has is much more diverse than other teams. And then when you break it down even further to focus on the leadership in child welfare and administratively, you can see that that's clearly an area where we are challenged to build diversity. So that I wanted to include that because I think it's important context as we think about then the decisions that gets made, because the starting point is who is making them and what is the lens that informs their judgments. And clearly, we need more diversity. I included this because the states, some of the state data, it takes a little while to catch up with everything else. Wanda also had demographic. This was associated with the state's most recent published report on locality profiles. But you can see that they're pulling from 2018. And at that point in time, the breakdown was 82% white in Albemarle County and 18% all other races. So, with Wanda's data or this, the percentage of white population in Albemarle is between 82 and 77%, and our total minority population ranges between 18% and 23%. This is and this particular shot is available. It's this CPS Accountability Reports, and if you go to the public VDS site, these are available. And it goes back multiple years, and you can select which year you want to look at. But this particular one depicts graphically just the number of children served and their racial breakdown. And if you go to the next slide, this includes both that same data point with that middle bar has Child Protective Service referrals information, and that's the number of children being served in the referrals and their breakdown by race. And then I think the slide's important because it contrasts that with the children that we have in foster care in a given year. And in the foster care section, those 2 columns, kids in care and kids exited to adoption, that means they were at least in care for part of the year. So they're included in our count for total number of kids in foster care. So when you see those numbers, it quickly jumps out that the number of children that we serve who are minorities grows extensively once we get into foster care. And the next slide kind of gives us the percentages on that. So when you're comparing that, we started out with a total of 30% of referrals were children of color. And then you look at 62% of the children we have in foster care in that year are children of color. That's a cause for alarm at us when we look at that data point, because we need to understand what's behind that and how that happened. And that's looking back kind of two years ago, if you will. And then the next slides are the same series, but looking at 2019, the fiscal year that just ended. The 2020 fiscal year, I mean, 19 didn't just end, 20 just ended, but it's not available on the state data yet. So this is the most recent one that is. And you can see in this, like, our total numbers are going up a little bit, and our percentages are still, or the number of kids that are representative of minority children, it's hot. It's higher than our population. And then the next slide, Phyllis. Again, compared to our foster care, significant concern, because this trend is continuing where we're disproportionately represented, or we have disproportionate numbers of children of color in foster care. And then the percentages. Next slide, Phyllis. So again, you can see that compared to children of color comprising 29% of our total referrals, they comprise 55% of the children in foster care. And and it's so this trend continues. And then we have all been doing for a while a little bit of internal tracking, and the next slide reflects what we have within our agency database around the children in foster care. Can you go to that one? Thank you, Phyllis. I'm sorry. I'm sorry. Back one. Thank you. So for this current, the fiscal year that just ended, our internal data tells us that we had in foster care, 51% of our children were white, and the remaining 49% were children of color, Hispanic. This past year, we started tracking demographically who was open to services for ongoing CPS services in our family preservation unit. And that particular data point, at least in easily accessible report format, is not provided in the state database, so we have to track that independently. And as you can see in that, we're also opening to ongoing services a disproportionate number of families of color compared to our population. So what might this mean? That's a critical question, and one we want to figure out. It certainly, on the surface of these data points, it would certainly appear that people of color are disproportionately reported to Child Protective Services, given what the total population data point is. And then children of color are removed at a higher rate than white children, would be the other thing that sort of seems to jump out at that data. Next slide. So, what to do about that? We want to give a lot of thought about it, and I don't think there is one answer. And I think as we learn, we'll have other and additional ideas to go on. But the first thing we want to do, and Phyllis, to the next slide, we want to understand it better. And then, can you click again? Yeah. And then the next. So Mary Stebbins, the deputy director, and I have been beginning back in the winter, just really right before COVID hit, began having conversations with the UVA Public Data Lab to see what they could do to help us research and better understand what informs our decision-making across the child welfare continuum. they did a similar study for Charlottesville City DSS, and it was actually a 3-year thing. And at the conclusion of each year, they published a report. And those reports, of the completed portions of the study, are available for the public. And the city was kind enough to also share their outcomes with us, so which gave us a really great sense of the data and the ways that utilizing this partnership could help us think about our work. So next slide. So in the summary of what their initial investigative year will look like, I've added this, I included the paragraph about the purpose of the project. And we're really trying to be able to define where we have disparities that seem to be driven by race or ethnicity all along the child welfare decision point. You know, in the slides that I showed you, that just reflects 2 decision points. One, whether or not to open a case to ongoing services, or 2, whether or not a child can safely reside in their home, or do they need to be removed and enter the foster care system. So we hope as we get underway with the study, we'll also be able to look at other decision points, such as, you know, when we do investigations, there's a decision made whether or not it's going to be founded for abuse and neglect or unfounded. Once a child enters foster care, they have to establish goals. The initial one is determined by law. We always have to start with return home, but we need to understand if that goal is achieved equally with our children of color as it is with our white children, or are there disparities there? Similarly, children who are adopted, does that look the same, or are there disparities? Or how about the average length of time in care? Does that look the same, or are there disparities? So we really want to drill down and look at that. And then we're also really hoping that as we take a deeper dive into the data, we'll also have a better sense of to what extent some of what appears to be racial disparities might be lessened or equalized if we account for poverty, or if we're accounting for substance abuse or domestic violence and other factors that are more typically associated with something that will trigger child separation from their parents. Next slide. I also, and you can keep clicking till you 2 more times, Phyllis. Or another time. There we go. And so I've included in here, and we won't go over them in tremendous detail because I'm sure you've seen them before, but last summer when we created our strategic plan, you'll note that 2 of the 3 goals were around equity inclusion. And so focusing on, and one of those goals was increasing the diversity of the DSS workforce. We've established a work group. The pause button has been hit a little bit on that with COVID, but we have a really wonderfully diverse group that was energized and excited about that work. And we will be getting back to it soon, but that's one of our important strategies is trying to improve the diversity in our workforce. And Phyllis, if you want to just kind of quickly click through so you can see these were a couple of other identified strategies to accomplish that goal. And then these 4 also. So we've, you know, the thinking about this and the need to do that piece of it certainly has predated our recent looks at the data. Next slide. So what else beside those things do we need to do? I think we definitely want to engage in rigorous implicit bias training. You know, a key tenet of social work is has always been self-reflection and being mindful of what you know, social workers are there's training around being mindful of what you bring to an interaction with another person and how that influences your experience of it. And also training around of the other people's cultures and trying to understand that. But notwithstanding, we believe we need to do more on educating staff and heightening their awareness with regard to implicit bias. I've also asked all of our child welfare teams to identify each decision point in their respective program and then develop a tracking process or format that will account for demographic information and potential racial inequities if they exist, so that we, even if the state's not providing that for us in a readily accessible way, if we have it internally, we'll be able to understand our own work and really kind of dive in. So folks are doing that. And then Wanda and I, one of our task is to provide on an ongoing and monthly basis either articles or videos or other educational opportunities that we share with the managers that we supervise, and we share it with the expectation that at some point during the month, the managers are engaging in discussions with their teams around this and working through the material. You know, in the recent months since Mr. Floyd's death, there's been a lot of rich and meaningful training opportunities. And so Wanda and I's job has been easy to date because teams have on their own been excited about an opportunity to watch various trainings together or various videos and discuss those. So some of it is us just nudging things along and monitoring it. And then the other thing that we feel strongly about is with that we need to sustain the urgency. After August 12th, couple of years ago, we began these discussions and we intensely held them for a period. And then over time, it kind of waned off and we didn't have the same sort of laser focus on this very urgent and important issue. And we want to make sure moving forward that we sustain our focus and our intention, and we recognize that if we don't do so, it'll be a leadership fail. So we really want to make that important. Next slide. I included this because one of the trainings that I recently had the opportunity, or really wasn't a training, it was a webinar. Virginia Voices of Children sponsored it. And if you all like them on Facebook, you can have access to some pretty powerful content. And they had a couple of attorneys who represented one from legal justice and one from the Richmond Family Law Center, and then one of the Virginia Voices for Children's employee, and they discussed racism in the child welfare system. And it really, I was so uncomfortable as I sat and listened, because as someone who's spent their career intending to serve and improve the lives of children, it was a pretty sweeping condemnation, and pointed out some of much of how it has been historically rooted, first in slavery and then in other racist practices of our country, and that the white privilege that defines the ideal of what are families and what children need, that informs our child welfare decision making. And as uncomfortable as it was to hear, it was also really important because that's the kind of reckoning and wrestling we need to, an honest look that we need to do within our organization and our own practice to make sure that we are equitably and justly serving all families and all children. So some of the things that we have started with as givens might need to be re-examined. And one example they had, and I'm not saying this is right or wrong, I need to wrestle with it, but one thing threw out there is, you know, it's been kind of automatic that if you're a parent who abuses substances, you're often, more times than not, you're going to find your child removed from your care and custody. And that's pretty true. And particularly when the substances are like cocaine or meth or opioids and that sort of thing. But it challenged that to, you know, what could we do differently? Can we, you know, systematically, can we really work harder to have a parent in treatment with their child so that bond and connection can be maintained? And there were some other ideas that were thrown out along those lines. And that's the kind of thinking we need to do together in order to preserve families. So I highlight this today with humility, noting that Albemarle's got a lot of work to do in this category. And I also just would note that notwithstanding, there are areas, particularly around preserving family and the efforts we make to identify family placements when children come in the care. Like we excel and are leaders in the state in that. The state average of children in kinship placement is right around 9%. And Albemarle's typically runs between like 28 and 32%. So while we have tremendous amount of work to do in the area of equity, I believe, I also want to just make sure I point out that there's also a lot of really good work that's also currently going on. So with that, Wanda and I'll take any questions folks might have.
I had a question. You were saying that you were going to partner with UVA on a study, a longitudinal study for 3 years, and the years that were listed were from 2014 to 2017. Was that a typo? Are you going to be studying cases from the past, or is this an ongoing study that's going to begin now?
We hope it's going to begin now because right now it's before the IRB for approval. So we're waiting on that. And I think their initial data pool will be particular around those dates and they won't get the data from our agency. They're actually going to get it directly from the state and the state data warehouse. And so I think they're starting with that data.
Okay, that sounds really interesting. I'm glad to hear about that. I'm kind of a research geek, so I get really into that sort of thing. I love the numbers and the data that you guys had for us to see and ponder over. I was actually in that webinar, Alice, that you were talking about. The one I think it came up on Facebook and I saw it and I was like, oh, this looks really interesting. And so I listened to it and yeah, you're absolutely right. It was very uncomfortable to hear, you know, the views of a lot of people about the child welfare system in general. And it's hard to not take it personally when you're someone who cares and is trying to do the right thing. But I have to constantly tell myself it's not personal. You know, this isn't about me. This is systemic. If I have personally done things, then absolutely I need to be corrected and I want to do better. But like the institution is made up of individuals, and probably almost all of us think we're all doing what is right and our best and what we can. But what happens, I think, is that when we start to look at ourselves so much as individuals and we say, oh, no, I know she means well. She would never do that on purpose, or she would never do that. She's not racist, right? But like, then the whole institution that moves like a giant amoeba, shifting and changing form, often very, very slowly, that institution can be absolutely racist and can make bad decisions and harm people. Their impact and their intent are not normally the same. So it was a really interesting, I guess it was a webinar. I don't know what you would call that, a webinar, a presentation, a forum that we went to. Yeah, so I had another note. Oh, the last thing I wanted to say was the school system is having kind of a similar discussion. They have what they call an equity dashboard where they present the information. It's about standardized testing, but they also have it related to student discipline. And it's been very eye-opening for us to evaluate who gets disciplined in the schools and why. And you really start to see trends. And so if you only kept it at the building level and you'd only look at, say, Jewett Middle School, you know, where I work, you might look at Jewett and say, well, there's not really a problem because here in this one location, this is how they're doing it. But when you look at all the schools in the county, all 25, you start to say like, whoa, we really are suspending Black students way more than white students, and for the same, if not even, you know, not as bad infractions. So we did a book study on this book called Push Out, which is really interesting. I don't know if you guys can see it.
Yeah.
The criminalization of Black girls in schools. And I highly recommend this to anyone. You don't have to be a teacher to read it and to get some really good information out of that book. So yeah, I'm glad to see that this is being discussed. And if anyone else has any questions or comments.
Mary, who was the author of that book?
Monique Morris.
Thank you.
Mm-hmm.
So
I have a general.
Go ahead.
I have a general question. Alice, I love the work that you all are doing with kinship placements. Do you feel like in one population more than another that you're getting the kinship families that you need to prevent children from coming into care? Or is that too vague question?
You know, I think I need to check our data around our family finding, and then maybe I can email it or have Phyllis email out to you all a response to that specifically. I will say off the top of my head, no, I'm not aware of a particular population that we're not finding, but I do know that I'm pretty sure they do track for race and ethnicity in our internal. We have our own database on family finding, and I think they track for that. So and if they don't, they'll start. But I need to look at that and find out to answer your question, because I'm not aware, and I go to our family finding meetings that we have monthly, and that hasn't been identified as a challenge, but I need to look at the data, and so I don't know.
Because it certainly is a way to keep kids out of care is when you have the kinship placements.
Yeah.
Can I ask a quick question? I don't understand how everything works, and so this is kind of a how does this work question. When you gave the diversity or racial background of the people making the decisions to put kids in foster care, was that the 7 folks that you had that had a little more diversity within that group, or was that, who makes the decision for who goes into foster care?
Well, ultimately, the caveat, ultimately it's the judge. I always have to give that shout out. However, at the organizational level, who puts that forward, it is either our child protective services worker, or it is our family preservation workers who work our ongoing CPS cases. Those are the 2 units that when necessary, will file abuse and neglect petitions and recommend removal. So some, right currently in the CPS team, there is no diversity at all. It's all white women. We have a vacancy that we're currently trying to fill, and we did this time, one of our newer initiatives is we advertised it in the National Association of Black Social Workers with the hope that our pool of applicants will be more diverse than a lot of our pools of applicants, because in the past, we're always limited to who applies. And we're coming out of a period where organizationally, we were not actively recruiting. We just went wherever it always got posted, which is the state website and the county website. And we didn't have particularly diverse pools. So we're hoping by utilizing this, it'll help us with the diversity. And we also, in our most recent posting for our vacancy in foster care, we've also advertised with the National Association of Black Social Workers, and they'll do 2 blast emails and post it on their site, which is a static posting, but at least it gets us out there. So hopefully we can address that in CPS. And the family preservation team does have some diversity. It has a total of 7 staff, and 4 of the staff members are bring diversity to it.
Actually,
Oh, go ahead.
oh, sorry, Liz, did you have something else?
Well, I have a question that I'm almost scared to ask because I'm afraid it's going to be misinterpreted as either I was a horrible mother or something like that. But I'm curious if this would be picked up in your investigation of these numbers. Having in my very Caucasian world with my children, one thing that I noticed within that world was that there were behaviors within families that were quite different than other behaviors in other families and more acceptable in the schools, you know, and maybe that behavior would have seemed completely normal to me, but wasn't considered normal to the school administration. And so I don't know how that really is reflected in different racial backgrounds, but I'm wondering if when you look at these kinds of things of how your numbers work, if it has to do, if those kinds of behavioral norms within families would be picked up, if that makes sense.
Well, I do think we definitely think a lot about another thing that informs the lens that we work is trauma and how that has, people's personal histories have informed who they are today and their behaviors. And so for so many of the folks that we serve, like these children, whether it's the children or the parents' lived experience, there have been multiple traumas. And, you know, so your example was the school system. A lot of the parents we work with as children had terrible experiences at school. And that informs what they bring to the school interaction. And you know, yes, we are aware sometimes that informs the school's response to those parents and their understanding of the kid, you know, like so we do think about some of those things, absolutely. So there's some of that.
Okay, thank you.
I'd like to offer some thoughts on that. You know, one of the things that I worry about is, particularly in child welfare, a lot of the decisions are based on what one believes or how one defines, for example, a family. You know, and what one believes about discipline. You know, and so if the workforce makeup is not diversified, then that just adds the more potential to make decisions coming from one's own definition or one's own bias. I know, you know, Alice mentioned the kinship placements. One of the things that I'm particularly proud of is that several years ago, we expanded the definition of kin. And it's not just biology. It's the soccer coach. It's the Sunday school teacher. Remember years ago, we had a family who was adopted by a whole church, you know, it took them under the wing. And so, you know, I think that's the challenge for us, is to make sure that we are sufficiently and continuously educated, and also that we have a workforce that brings all sorts of different beliefs and definitions, and so to help our decision making be much more objective, but most importantly, a decision that honors what a family believes and what's a part of their culture and history. So anyway, I just offer that too.
I also just too would quickly note that while this is very definitely an Albemarle challenge, it's a national challenge too. It's a struggle throughout the child welfare system. So I just wanted to highlight that. And Mary, one quick thing I wanted to say in response to something you said earlier, when you mentioned Brene Brown, I just wanted to let you know that our child welfare supervisors this year, we're not going to be able to do a lot of elective training. So we ordered some books that we could read together and discuss. And the one we're leading with is Dare to Lead by Brene Brown. And then we've also, we've got one, How to Be an Anti-Racist. We have one on trauma-informed stewardship, and another one on white privilege.
Actually, this is Amy Lawfer. I had some other questions. I'm sorry I'm late. But going back to the report, you know, maybe you covered this, but how are the referrals made? And what is the threshold for removal? It feels to me like, you know, some of this stuff should really be process oriented. Do you know what I'm saying? I'm sure it is. I'm just curious about those two things. And then I have one other thing after that.
Well, referrals are, you know, made from various folks in the community. Our top referral source is the schools. So we typically, when schools are either closed in the summer, now during the COVID closures or shutdowns, you know, that our referral numbers have gone down, and I think that reflects it in part. But we, you know, schools, hospitals, community members, family, you know, concerned neighbors, that's typically, and it's anybody who has a concern about a child calling in. You know, one of the things I realized that in all honesty, I had not totally appreciated till I was revisiting this data for today is our screen outs, the volume we screen out is way higher than the state average. Like our most recent stuff had us only screening in about 30% of all calls, 30 some. So there's already like a lens that's filtering. And then for removals, we try very hard for that that should really only occur as the absolute last resort, that there is no other way to ensure a child's safety. And those other ways include you know, the child staying with the grandparent, or the child's, you know, are there other people, the child that could get custody? If the parent can't be the custodial person in charge of the child, is there somebody else who could be that's in their family that could meet that child's needs? And we have our own internal process around family finding that we try to do before every removal where at all possible. And that's why our numbers are higher in the state, because we spend a lot of manpower hours using the search tools that the state provides us to identify family members and call them and engage them in this process of helping us make a plan for their child so that removal is not necessary. So not in this data like would be the total number of cases we worked and the number of times we didn't remove when we might otherwise have. That's would be more reflected in our effort stuff. But we do try really hard to make it a last resort, and it really needs to be about child safety. Like we really got to feel if that child stays with the parent, significant abuse or neglect or trauma will continue to be inflicted on the child. And if we don't, and really that's the court's, that's what the court wants to know too. The judge is the one who ultimately decides, and it's really supposed to be about child safety. Now, once the child gets out, and maybe this is an area for change for child welfare, return home starts to be less about imminent safety. Because maybe the issue that got, you know, maybe mom's gotten her drug treatment completed and she's not using, but she might still not have recovered from the homelessness. That's part of that. And so she still doesn't have a place to live to have her child return home to. So that, and if she had a previous eviction, trying to find a home in Albemarle County is doggone hard. So the getting back home, other issues start to be factors, but what should get you out of the house should only be about imminent safety. The other thing our agency does, and this might be a practice that we revisit, because we've always thought it's a good thing. Other localities don't necessarily do it. When we safety plan a child out of the home, if they're not going to be returning home by the time we're closing the case, then we go to court, because we're not going to have told somebody that their kid has to be out of the home indefinitely, because one, we don't have the authority for that. And they have due process rights that court processes protect and afford people. So if we still think it's not safe, if you can't go back to your parent after that safety plan, then we're going to go to court. There are other localities who will safety plan a child out of the home and tell those parents they can't have their child back and close the case. And we don't do that. And sometimes that means parents don't get their kids back, and other times it means as soon as DSS is out, those kids are right back with the parents, and we're getting new referrals. And that's how we know it happened, because we looked in the record and saw, oh, that locality did that. So I don't know if there are areas in there where we go to court and maybe we don't need to. Maybe we should look at that some, if that would help us a bit. I don't know, but I just throw that out there.
I think, Catherine, were you starting to say something? You're on mute, though. Catherine, you're on mute. There you go.
Unmuted?
Yep, you're good.
Okay. I'm sorry. I muted you because something was happening back there. No, I'm going to just say, I was on the social service board years ago, and to see what was going on then and what's going on now, social services has come a long way, and there's so much personal stuff that's into it, more than it used to be. The localities have more to say now than what the state used to have, or the federal would have you to do. But we talk about frontline workers. When we do our prayer, I always put the social service department in it, because everybody think about nurses and doctors and this and that and the other. You guys are on some frontline positions that are terrible. And in most cases, you don't have a choice to move back. I mean, you got to go. You can't say no. So I really think some of this today, I feel really sorry. I'm glad things are doing what is being done, but I'm glad my children are grown. I was a mother of 4 daughters. I'm glad I'm all over that, because we were raised, and I raised my children, that they had to respect, and you better not get in trouble at school, and you better do this, and you better do that. And I expected that, and that's what they did. Driving the school bus for 39 years, I saw a whole different child, whole different way of life. And I had to adjust to it. And I've had some cases, sort of like you guys. I got caught in the middle of it, but I just had to stand firm for what was right. The personal part of it is what gets to me, that I reach out and say, thank the Lord for social workers, because you have to deal with some challenging decisions. And then you have to go home, and you're only human. So it's a real tough life out here right now. But if there isn't people like the social service department to work with the schools or the communities, where would we be? I mean, it's rough out there. So we try very hard, even in that, our communities, we try really hard to try to reach out, help, whatever you can do. And sometimes our hands are just tied. So I just hope things will get easier for the social service workers. I mean, all departments when I say social services, but it's rough out here dealing with families and children and going through challenging times. Not only I'm not just talking about the pandemic, I'm talking about the world as a whole. And nobody knows what all of you all go through. I mean, you can read what happened on a piece of paper, But what you personally endow on your own heart, nobody else feels that but you social workers. And it's hard. But I will say the fact that you guys work hard to keep families together and offer, look into for grandmas or aunts or whoever there might be that would take a child, that's a really big plus. And that wasn't always there. So I just admire you and continue to pray for you. And I pray for the school system, Mary. It's really challenging right now. And I know we are talking about racial issues, but all of this is not racial issues. We're wasting a lot of time on some things that we really need to be moving on, like a child can't get its education. I mean, that to me is more personal than what color the child is, you know. So I'm from old school, sorry, but I want to commend you guys and continue to do what you're doing. And I do think that communities need to reach out more and see what we can do to help. So having said that, when we get to something else, I'll bring up something else, but we were trying to do in our community. But thank you.
Thank you.
Thank you, Catherine. Alice, I don't know if you've seen the chat. I'm not sure what HBCU means.
It's historically Black colleges and universities. And yeah, thank you all for that suggestion. When our work group convened just prior to COVID, we had working with us from HR, Joyce Ivory, who was a wonderfully talented woman who was, and it brought a lot of energy, passion, and direction for us to help connect us. And that was one of her thoughts as well. And so has a HR representative. She had been reaching out to some of the HBCUs to build those relationships. And unfortunately, for us, good news for her, she moved on for another opportunity. And I think her position is frozen, and the work group with COVID stopped working. So and the other thing, there was an event we had planned to go to. It wasn't at a HBCU, it was at VCU with their Association of Black Social Workers. And when that got canceled because of COVID, and a lot of the traditional recruitment events have been canceled with all this. So that is definitely an area we want to target and establish a process and establish relationships with schools so that we can let folks know about Albemarle and hopefully garner interest in being employed here.
Alice, this is Amy Lawfer again. Just one other thing. I know when I was with the city schools, the HR department started really talking about, like, you know, if you move here, this is what the town looks like. This is, you know, they kind of made it more about, because millennials in particular really want to live somewhere that feels, you know, compatible to them. And so they kind of made it like a lifestyle discussion, more not just about the job, because, you know, where you live is so much more than your job. So that's just, you know, I'm just sharing that.
Okay, thank you.
I wanted to bring up kind of to connect with what Amy was saying when she was wondering about what the criteria were for removal from the home. Are you talking with law enforcement about this issue? Because I think at some point they are feeding people into this system in a way. And we know that we have a disproportionate minority impact from law enforcement. That was uncovered, and I read about it, and I believe it was the annual report that was out in January. And so, you know, if they are disproportionately arresting or charging people of color with crimes much more than white people, then you're automatically going to end up with the children of those people who then are going to be put into the system. And so part of this discussion needs to be had with law enforcement. Are you talking with them at all?
At this point, around disproportionality and the intersectionality of our two systems, we had not yet, but that's definitely a great direction to go in. We do get a lot of reports from them because we get arrest reports if there were crimes committed in front of a child that would negatively impact that child. We get reports, and particularly we get them any day of the week, but we get them a lot on Monday mornings from weekends. That's the first thing our CPS intake worker does, is review the police reports from the weekend and determine what gets screened in or screened out. So that's a great direction to point us in. Thank you, Mary.
Mm-hmm. And then I made a note because I would like to talk about evictions. You were saying how, when a parent may finish their substance abuse treatment program, but then they may have nowhere to live. And so they don't get their child back if they don't have anywhere to live. Just related to COVID, I fear that we are about to face a wave of evictions. I've heard a lot of people in the community, I've seen it on Facebook, people are talking about how they don't have the money to pay their rent and they don't have anywhere to go. So, that problem I see on the horizon, and I don't really know of any way to avoid it. So is DSS, have you made an emergency plan of what you're going to do if you all of a sudden have a bunch of people facing eviction or even homeless? And is there anything we can do to try to mitigate it even before it happens?
Well, we're certainly, go ahead, Phyllis.
A couple things. One of my informational items talked about how the county received about over $9 million in CARES Act money. And actually Siri and I have been working together to recommend that we use some of that money to provide rent and mortgage assistance or other financial assistance. And we're trying to get that started. We're recommending that we contract with United Way to administer that. So there's that in place. There's also, Wanda, if you can sign on to explain the eviction moratorium. That's not a part of our Office of Housing, but it is in place. Do you know more details about that you can share?
Only that it's been extended again, and that the problem is that just means you can't evict now, but as soon as they lift that moratorium, now I want all the back rent and you get 30 days and here you go. So that part of it is you're right, Mary, it's right on the horizon and we see it coming. The Office of Housing also is going to be putting out a lot of vouchers. We've got a lot of new vouchers that we're going to be able to offer people who are already on our waiting list. So we're very excited about being able to do that in the range of like 100 vouchers between now and December. That would be 100 families that we can get into some good rent assistance subsidized housing.
And Mary, I would just say that even pre-COVID, when folks have housing needs, that's been one of the hardest issues for us to address, because in Albemarle, I feel like we have more resources sometimes than others surrounding localities, but even that, there's such a limit to how much we can help people with like rental or mortgage assistance, et cetera. If there's not money to pay these back things off, it really ties people up, and that it just keeps getting in their way. And there's a very small pool of landlords who aren't going to be 100% reliant on that credit check for making their decisions. Like there's just not many that do that.
Right. Well, also, if they have an eviction on their record, it's going to be really hard, even if they came up on the waiting list and now have the opportunity. They still have to find a landlord that's willing to rent to them with past history. So it is going to be a challenge.
Yeah, I guess, the vouchers, I'm glad you said that about the vouchers, because I knew they existed, but I guess I didn't know to what extent. And I remember hearing and learning about the waiting list in the past, but So they get the voucher, but is there a way we can pre-identify locations that will accept them immediately? Can we start some sort of community list where we have landlords that have already said, I have a vacant property and yes, I'll accept a voucher, and just try to work it out ahead of time to save energy?
Well, we have a list of landlords that are willing to be put on the list. And we can provide that. For the Housing Choice Voucher Program are that we cannot help them find a place. They have to find a place. So we can give them previous landlords lists, and if the landlords haven't kept their lists up to date, it can be a nightmare for people to, go through that list. There are a couple of project-based vouchers as well, but those are very specific to the place. So the voucher actually belongs to the unit versus to a person to just go anywhere you want. So, and then those are limited with what types of housing that is available at that specific project, whether it's a 1-bedroom or a 2-bedroom or what have you. So there are a lot of regulations and rules that we have to follow in the process. And the biggest one right now is we do have a waiting list. The waiting list is closed. We have enough people on that waiting list. We feel that we will be able to offer some vouchers out to about 100 families. And between now and December, we hope to get that started. The vouchers will pay, the family is expected to pay 30% of their income into the rent, and the subsidy is for the remainder. The subsidy also is limited, so it gives you a rate for how number of heartbeats. It's 2 heartbeats per bedroom. So that's the format for the housing standard that we use. But we are excited to be able to issue some vouchers and get some of that going. It's going to be kind of challenging because every place that is selected, every person that is selected to get a voucher doing this, during COVID is difficult. Finding landlords that are renting during COVID is difficult because they have units they're not getting paid for, but they can't evict. So there's, it's going to be tough. It's just a catch-22 situation. But
So let me chime in here, because there's also a couple of other initiatives going on that's not related to our specific Office of Housing. Some CARES Act funding is being used by the Planning District Commission to create a regional affordable housing search tool and resources website. Additionally, the housing policy that community development is taking before the Planning Commission, I think today,
yes.
Has some recommendations for making it more appealing for landlords to accept the vouchers. So there's other things going on the community development planning side of the house. So we are at 4:43, and I think we probably should make sure we can approve the minutes from last month or last meeting, since we now have a quorum. But any final question for Alice and/or Wanda?
Thank you. It's been really interesting. Yeah.
Welcome.
Thank you, Alice and Wanda.
Yeah, thank you. And I'm going to sign off now. Thank you very much.
Thank you for joining us, Liz.
Thank you, Liz.
Okay, do you want to go ahead and approve those minutes then? You want to do that now?
Sure.
Okay, so the minutes for the June meeting were sent out via email, and hopefully everyone had a chance to review them. Does anyone have any changes or corrections that they suggest for those?
No.
Okay, then I will need a motion to approve the minutes.
I still need to approve the June minutes.
Okay, so Catherine made a motion to approve. Do I have a second?
I second.
Karen seconded. All those in favor say aye or raise your hand.
Aye.
Motion passed. I believe everyone said aye. Next, I think we're supposed to talk about the message out, right, Phyllis?
Yep.
Sorry, I've never done this before. I'm just staring at the agenda.
You're doing great. So I will definitely share the PowerPoint if that would be helpful. But it'd be helpful to just kind of get a sense from you of what either from the info items or the presentation you would like to highlight to your respective supervisor.
So you're saying at this point, the whole PowerPoint wouldn't be given to them?
No, that's fine. Yeah, that I can attach it. But what I usually do is then in the narrative and the email.
Right, right.
Out. And so if there's anything you'd like for me to bullet, I can do that.
You know, I
So
believe,
comprehensive.
oh, sorry. I can put my video on. Sorry, my kids are just running around. And my own caseworker just had a phone call with me, so I'm sorry. I would say if, you know, the things that I think are important from this is the numbers that, you know, they shared, not the table, but the pullout of, you know, for foster care and removal. And then the goals of the Board of Social Services, what they are trying to accomplish next. Those are those last slides. And I think Alice had given some information and Mary had attended a webinar. I think these are the kind of things maybe the Board of Supervisors would like to see. Where is the direction of social services heading?
Sounds good.
Yeah, I think if you provide that presentation, the slides were really good. I like having the visuals. It helps me, you know, remember what it is we talked about.
Okay. Anything from the info items that you'd like to highlight?
I think maybe just a short update on Bright Stars. I'm always blown away that Bright Stars is just constantly working all year. I mean, I think most people think like, well, school's out for the summer, so they're just not doing anything. But like they are all really pretty busy and keeping in touch with their families, and the needs don't stop just because the school year stopped. So if we can make sure that they know that, because I know that the Board of Supervisors is very supportive of that program, but I want to make sure that they know that their support is making some good work happen and that it'll continue in the future.
I'll include family support as well, if that's okay, because they didn't stop working either.
Absolutely, yeah.
Good. So what happened with the overcrowdedness of the Bright Stars at Cale? What did they do about that?
That got tabled when the pandemic hit, because the what they were looking at would have required a significant amount of funding to do the construction at Walton. So when they had to revise the budget, that got taken out.
And I would just note the focus really right now is number one, getting enrollment numbers, because right now we're down. You know, it's not like last year in terms of total numbers. And we're concerned about that because the funding for the educational staff is per pupil from the VPI grant, and it's important that we have enrollment numbers. And then once we have numbers, you know, social distancing requirements for when there is a return to school, is it going to impact our ability to serve all these kids? Because we're going to have to find additional space beyond their classes at school, because the school does not have, they've told us what they have and how many kids can be allowed per class, and then we have X number of kids we still need to find a classroom space for. So Carol and Lisa Molinero from the school system are working exceptionally hard, both around recruiting and enrolling, and also concurrently trying to identify space so that when hopefully we are back in school at some point, when it's safe to do so, these children we have a space to offer.
Thanks, Alice. Anything else for the message out?
Should we talk to them or give them a heads up about the how you're prepared for 100 vouchers for possible future evictions, or should we just wait since there's an eviction moratorium right now and it's not really at the top of the list?
Yeah, what I can do is highlight the housing item because I think that Philip included that, if I remember correctly. But yeah, I'll highlight what's happening in the housing program. Yeah, because he talks about continuing to issue new mainstream vouchers as well as, providing required accommodations. So I can bullet that out.
The only other thing I was thinking, sorry, Phyllis, anything that has to do with COVID obviously is probably the top of the, really, especially as Alice said, working with the schools. These are all going to be the top concerns right now.
We made a presentation to the Board of Supervisors that outlines some of our recommendations for what we want to use the CARES money for. And so Roger Johnson, the Director of Economic Development, described his business grant proposal. And then Siri and I described our recommendation for using it to provide emergency financial relief, as well as assistance to certain nonprofits that are providing services. So they did get that because they had to approve the appropriation of the funding.
Yeah, maybe it's like a two-part thing. It's really just what's happening in the immediate. And then I feel like the recommendations that Alice had for, all the goals, that's more long-term really.
Yeah.
So.
Yeah.
Okay, well, I think that takes care of the message out, unless you need any more, Phyllis?
No, that's good.
Okay, and I forgot to ask if any board members had board member business. Did anybody have anything to share this month?
I have a question about the kids going back to school. One of our churches took on Walton Middle School as a community project. And so we all collected items and they gave us, not me, but them, a list of items. So we all of the 18, I don't know who all contributed, but I sent it out to all 18 churches. So we got the supplies that they were asking for. We have been giving out masks off and on. We've also people have been donating masks and we've been collecting masks. So what are they doing about the masks or people needing masks for kids going to school? What is it is there anything social services know that communities could help with the kids going back to school or maybe not going back to school, but they still got to do schoolwork?
So DSS has been involved with other community partners in several mask distribution projects as well. That one of the things that the Office of Housing did with their CARES money is they made cleaning kits, which included masks. So all of the residents who have a voucher the opportunity to come get them. I am not sure what the school system is doing regarding masks. I know that when we go out on home visits, we often take masks for them. And our Family Support and Bright Stars folks have been very involved in the mask distribution sites, but that's the extent of my limited knowledge.
Well, the reason I ask, because I have two huge bags of all beautiful colors and kinds, and some of them are small, some of them are more like children. So I didn't deny them. I said, give them to me and I'll have them and we'll see what we do. So I thought I would start with here, but I will reach out to the school systems.
Yeah, our school, like the school my son attends, the elementary school, has asked for donations. They aren't going to give these children a mask every day. They want the children that are coming back, which is a very small group because it's most of the most severe special education needs, and then a very small group of English language learners. And anyway, so they're not going to be giving them masks, but if a child arrives at school and doesn't have one, they want to have them available to provide. And so that was, I know the school system intends to buy them, but they said they wouldn't have the resources to provide a new mask for every student every day. So if you contact Walton Middle and see if they need them, and if not, contact Mountain View Elementary and see if they can take them, and go from there.
Okay.
Catherine, there's also a group called International Neighbors, and they often distribute things to, families that are refugees or immigrants. And I can send you her contact as well, because that might be a good place.
Okay. Because like I said, most of them are better for children's houses. They vary, but it's a lot of kids out.
Any other business, anybody?
Actually, Mary, I just have a question for you. Where is the information about who is being selected to be in person? Is it on the website or no?
Yeah, I wish I knew. They just revamped the county website. Everything was changed yesterday. So I haven't even navigated through the entire new website to find where it should be. But parents were supposed to be contacted very soon if their child is one of the ones to be attending in person. It's like 100 students for special education. It's like 100 students in the whole county. So there are so many parents who think their child is in this group that's going to be going to school, and they actually aren't. I would contact, the school yourself and just try to get information personally. But I think they should contact everyone and not just say, well, we're only going to contact the 100 kids who are coming, because then all the parents that don't hear anything are going to be left wondering, like, did I just miss a phone call or an email? So yeah, the criteria has not been explicitly laid out. They did say the A base and the C base groups, which are very small, like the A base is autism, self-contained classes. Yeah. So unfortunately, it's not public knowledge right now how they're making the decision.
Okay, thank you.
Yeah. Okay, well, I guess if we're done, does anybody else have anything? No? Okay, then we will see you all next week. And do we have to vote on ending the meeting? I don't know how to.
Motion.
Yes, you do have to have a motion to adjourn.
Okay, someone move
Next
to
month,
adjourn.
not next
Actually,
week.
Mary, can I one other thing I wanted to say? Lisa, or Phyllis, I'm getting really, it's really hard for me I didn't get the link today. Thankfully, Mary, we were Facebook messaging. Maybe I could Phyllis, I'll just email you, because this is the second month in a row I didn't get the Zoom link. It just so happened last month I had a calendar with it on, but I'll email you separately.
Yeah, let me check to see on the distribution list, to make sure you were on it.
Okay, so you want to move to adjourn, Catherine?
I will make a motion that we will adjourn the meeting.
In a second?
Second.
All right. Meeting's adjourned. Nice to see you all.
Nice
Good
to
job,
see you all.
Mary. You did a very good job.
Thank you for your support.